Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Deep Sea Physiology, Chapter 129. Introduction. In high altitude, the problem is with low atmospheric, barometric, pressure. In deep sea or mines, the problem is with high barometric pressure. Increased pressure creates two major problems: compression effect on the body and internal organs, decrease in volume of gases. Barometric pressure at different depths. At sea level, the barometric pressure is 760 mm Hg, which is referred as 1 atmosphere. At the depth of every 33 feet, about 10 m, the pressure increases by 1 atmosphere. Thus, at the depth of 33 feet, the pressure is 2 atmospheres. It is due to the air above water and the weight of water itself. Pressure at different depths is given in Table 129.1. Effect of high barometric pressure, nitrogen narcosis. Narcosis refers to unconsciousness or stupor produced by drugs. Stupor refers to lethargy with suppression of sensations and feelings. Nitrogen narcosis means narcotic effect produced by nitrogen at high pressure. Nitrogen narcosis is common in deep-sea divers, who breathe compressed air under high pressure. Breathing compressed air is essential for a deep-sea diver or an underwater tunnel worker. It is to equalize the surrounding high pressure acting on thoracic wall and abdomen. 80% of the atmospheric air is nitrogen. Being an inert gas, it does not produce any known effect on the functions of the body at normal atmospheric pressure, sea level. When a person breathes pressurized air as in deep sea, the narcotic effect of nitrogen appears. It produces an altered mental state, similar to alcoholic intoxication. Mechanism. Nitrogen is soluble in fat. During compression by high barometric pressure in deep sea, nitrogen escapes from blood vessels and gets dissolved in the fat present in various parts of the body, especially the neuronal membranes. Dissolved nitrogen acts like an anesthetic agent, suppressing the neuronal excitability. Nitrogen remains in dissolved form in the fat till the person remains in the deep sea. Symptoms. First symptom starts appearing at a depth of 120 feet. The person becomes very jovial, careless, and does not understand the seriousness of the conditions. At the depth of 150 to 200 feet, the person becomes drowsy. At 200 to 250 feet depth, the person becomes extremely fatigued and weak. There is loss of concentration and judgment. Ability to perform skilled work or movements is also lost. Beyond the depth of 250 feet, the person becomes unconscious. Prevention. Nitrogen narcosis can be prevented by mixing helium with oxygen. Helium is used as a substitute for nitrogen, to dilute oxygen during deep water diving. Helium also produces some effects like nausea and dizziness. But, the adverse effects of helium are less severe than nitrogen narcosis. Nitrogen narcosis may be prevented by limiting the depth of dives. Effects of nitrogen narcosis may also be minimized by safe diving procedures such as proper maintenance of equipments and less work effort. In addition, alcohol consumption should be avoided 24 hours before diving. Treatment. Symptoms of nitrogen narcosis completely disappear when the diver returns to a depth of 60 feet. There is no need for any further treatment since nitrogen narcosis does not have any hangover effect. However, the physician should be consulted if the diver loses consciousness. Decompression sickness. Definition. Decompression sickness is the disorder that occurs when a person returns rapidly to normal surroundings, atmospheric pressure, from the area of high atmospheric pressure like deep sea. It is also known as dysbarism, compressed air sickness, caisson disease, Benz, or diver's palsy. Cause. High barometric pressure at deep sea leads to compression of gases in the body. Compression reduces the volume of gases. Among the respiratory gases, oxygen is utilized by tissues. Carbon dioxide can be expired out. But, nitrogen, which is present in high concentration, i.e. 80%, is an inert gas. So, it is neither utilized nor expired. When nitrogen is compressed by high atmospheric pressure in deep sea, it escapes from blood vessels and enters the organs. As it is fat-soluble, it gets dissolved in the fat of the tissues and tissue fluids. It is very common in the brain tissues. As long as the person remains in deep sea, nitrogen remains in solution and does not cause any problem. But, if the person ascends rapidly and returns to atmospheric pressure, decompression sickness occurs. Due to sudden return to atmospheric pressure, the nitrogen is decompressed and escapes from the tissues at a faster rate. Being a gas, it forms bubbles while escaping rapidly. The bubbles travel through blood vessels and ducts. In many places, the bubbles obstruct the blood flow and produce air embolism, leading to decompression sickness. Underground tunnel workers who use the caissons, pressurized chambers, also develop decompression, caisson disease, sickness. Pressure in the chamber is increased to prevent the entry of water inside. Decompression sickness also occurs in a person who ascends up rapidly from sea level in an airplane without any precaution. Symptoms. Symptoms of decompression sickness are mainly due to the escape of nitrogen from tissues in the form of bubbles. Symptoms are severe pain in tissues, particularly the joints, produced by nitrogen bubbles in the myelin sheath of sensory nerve fibers. Sensation of numbness, tingling or pricking, paresthesia, and itching. Temporary paralysis due to nitrogen bubbles in the myelin sheath of motor nerve fibers. Muscle cramps associated with severe pain. Occlusion of coronary arteries followed by coronary ischemia, caused by bubbles in the blood. Occlusion of blood vessels in brain and spinal cord also. Damage of tissues of brain and spinal cord because of obstruction of blood vessels by the bubbles. Dizziness, paralysis of muscle, shortness of breath and choking occur. Finally, fatigue, unconsciousness and death. Prevention. Decompression sickness is prevented by proper precautionary measures. While returning to mean sea level, the ascent should be very slow with short stay at regular intervals. Stepwise ascent allows nitrogen to come back to the blood, without forming bubbles. It prevents the decompression sickness. Treatment. If a person is affected by decompression sickness, first recompression should be done. It is done by keeping the person in a recompression chamber. Then, he is brought back to atmospheric pressure by reducing the pressure slowly. Hyperbaric oxygen therapy may be useful. Scuba. Scuba, self-contained underwater breathing apparatus, is used by the deep-sea divers and the underwater tunnel workers, to prevent the ill effects of increased barometric pressure in deep sea or tunnels. This instrument can be easily carried and it contains air cylinders, valve system, and a mask. By using this instrument, it is possible to breathe air or gas mixture without high pressure. Also, because of the valve system, only the amount of air necessary during inspiration enters the mask and the expired air is expelled out of the mask. Disadvantage of this instrument is that the person using this can remain in the sea or tunnel only for a short period. Especially, beyond the depth of 150 feet, the person can stay only for few minutes.